Today I'm going to give you a demo of Gennie software and how it can be used by doctors and clinics. You have to use a browser to use the software. I'm using Chrome today. On Chrome, you type healthgennie.com and it will open up the Gennie website. On the right hand side, you see the login button. You click on that and it will take you to the login page. On this login page, you type your credentials and you will get these username and password after you register for Gennie. Once you put your username and password, you click on login and it will log in to the software. Now you are in the software where you see different modules. There is a schedule module where you can manage your appointments. There is EHR, which is electronic health record, where you can manage health record for your patients. You can use the pharmacy module if you have an in-house pharmacy. There is a billing module for billing for the patients. There are a lot of different type of reports which I'm going to show you a little later today. Then there is lab and radiology, which can be used also and manage it very well if you have an in-house lab or a radiology department. And then you have settings where you can manage the entire software based on how you want to use it. So let's start with scheduling. On the left side, you see two doctors, Dr. Sudhanshu Goyal and Dr. Himanshu Goyal. If you check both the doctors, you see both the doctors' schedule on the screen at the same time. So this is very helpful for multi-specialty clinics or polyclinics where they have more than one doctor. The front desk staff can manage the appointment for all the doctors on the same screen and they don't have to toggle. To register a patient, you click on this plus sign on the top where you can see the patient information and add it here. Let's say I add myself as a patient. I can add my name, I can add the date of birth, and there are a lot of options which you can add in. You can put the phone number so that the patient can get messages for appointment registrations and for different kind of billing and reports. Once you have added the patient, you can also take a picture. You can put the address, father's name, email ID, and a lot of other information. You can check these if you want the patient to get email and SMS. Once I'm done with this, you can submit this information and the patient is added in the system. Now let's create an appointment for Dr. Sudhanshu Goyal. On the screen, you see there are different time slots. So Dr. Sudhanshu Goyal has time slots which is from 9 a.m. until 11:55 a.m. and after that the doctor doesn't see patients. And this is a setting which you can mark in the settings tab. Let's create an appointment for 9:10. So you click on the slot 9:10, you see the appointment screen. Now you have to select a patient. So you go to patient lookup and then search the patient. I'm going to search the patient by his name, Senki. I get this patient. You can also search the patient by patient ID, date of birth, mobile number, father's name, etc. And then you select the patient by double clicking on it and it will select the patient and give you all the information. You can select the visit type for what the patient has come up for. So I'm selecting consultation and you see that the consultation fee has automatically been captured here. And this can be made into the settings. If a patient is referred by someone, then you can select the name of the person, which is also coming from the settings menu, and then you save the appointment. You will see that the patient's appointment has been made. Now, when the patient comes in to the clinic, the staff can check in the patient by clicking on check-in. If the patient wants to cancel the appointment, there's a cancel button here. And if the staff wants to take the payment for the appointment, they can click on the payment and take the payment. They can directly click on the payment and it goes to the billing screen now, where you can see that the patient bill has been made and the consultation charges has been added as 200 rupees. You can select the discount if you want, you can select the taxes if there are any, and then you can make the collect payment. Once you do the collect payment, it creates a receipt of the payment. and this is how it will show you as the receipt. Now you will see your practice logo here, where you see Health Gennie logo and then your clinic name and address and everything, and all the information you need to give to the patient as part of the billing receipt. You can choose to SMS the bill amount to the patient. You can also type the email ID, and if the email ID is captured in the system, it will automatically bring the email ID, and you can email the receipt also to the patient. You can print it if you want or email the receipt. Once the payment is done, the doctor can go to the EHR section. Now, the EHR section is where the patient will be seen by the doctor, and the doctor can put all the health record. In this patient queue, doctor will see all the patients which are already in the clinic and are checked in, and they can see for how long that patient is waiting for using the wait time. Now the doctor will go to the patient dashboard, which is on the right side. The doctor can see all the past vitals of the patient, all the allergies, and all the diagnosis history for a quick reference. It also gives you a small dashboard on the top for the patient, which gives you information about the patient. The doctor now can go to the clinical note on the left hand side, and this is where the doctor can make the prescription for the patient. Now, to ease the workflow of the doctor, we have created something called template. A template is a place where you can predefine certain things such as chief complaint, diagnosis, treatment, lab order, diagnostics, procedures, etc. This helps the doctor to reuse the information if a similar kind of patient comes in. So the doctor doesn't have to type the information every time. I'll give you an example here. I'll choose a template called viral. It is asking me if I'm sure if I want to merge the template. I will hit OK on it, and there you go. The entire template is merged and the entire prescription is ready. If the doctor wants to change anything, he can always go and change the information. For example, if he wants to change the chills to something else, let's say runny nose, and I save it, it will convert it to runny nose. So that is how the doctor can change or add or delete any information if he doesn't need the exact thing in from the template. The doctor can also put a follow-up date here, and which will also send a reminder to the patient on the follow-up day. So let's say I choose 28 November as a follow-up date. It is also saved in the system. The doctor can use this entire prescription for managing the entire health record of the patient. For example, chief complaints, diagnosis, current medication, treatment, eye examination, lab order, diagnostic imaging, procedure, allergies, dental procedures, patient history. I'm going to show you patient history now, where a doctor can very comprehensively take the patient history. For example, medical history, surgical history, family history, social history, hospitalization, gynecology history, OB history, and so on. Now this creates a very nice viewable prescription on the screen. The doctor can now print the prescription, and the prescription comes, preview shows it like this. The doctor will see the practice logo, where you see the Health Gennie logo here, and the clinic name, address, phone number, and everything. One of the very good feature here is that the doctor can choose on the right hand side if he or she doesn't want to show any particular information on the prescription. For example, some information is mentioned only for the doctor's information. So let's say if the doctor wants to remove chief complaint, so when he clicks on that, the chief complaint goes away from the prescription. If he wants to bring it back, then he can again check it and the information comes back here. Now the doctor can print it or email the prescription to the patient. Another feature which I would like to highlight here is the favorite system. What that means is the doctors can make favorite here, and anytime a patient comes in and the information is there in the favorite, the doctor can quickly click on it and add it to the prescription. The doctor doesn't have to search it or type it again and again to select that information. This helps the doctor create the prescription very fast, and it creates the prescription in less than a minute if the doctor gets used to the software. Similarly, you will see the favorite system in every single part of the prescription. Now, the prescription is ready, the follow up date has been specified, and the doctor can print the prescription, like I said, and give it to the patient or email the prescription to the patient. On the left hand side, the doctor can see all the history of the patient if he wants to. For example, you can click on visit history and see all the visits of the patient individually, when the patient came in to see the doctor, and what type of visit was there when the patient came in. If they want to see the old prescription, everything is saved in the date-wise format. Now, this is one of the very good information, because according to the guidelines, the doctor should have a copy of the prescription. And this area helps the doctor in doing that. So the doctor doesn't have to print or make a Xerox of every time a prescription is made. Every time a patient comes in, a clinical note or a prescription is created, and which can be viewable very easily. For example, the doctor can unlock a visit which was held on 22nd of August, and then go to the prescription and see what was done at that time. Similarly, all the vitals history can be seen, all the allergies, all the clinical examinations, all the lab results can be seen for that patient, all the diagnostics, prescription, procedure, dental procedures, eye examination, also the billing history. And there's one more very interesting part here, which is patient documents. Patient documents is a place where doctor can upload any kind of document, for example, a lab document or any other document for the patient on this in the system, so that every time the patient comes in, they don't have to carry their documents. So the doctor can go there and browse it, add any report, and this is how it's gonna upload it. And it will always be saved in the system. Doctor can create folders inside the patient documents where they can manage patient documents based on what kind of documents they are, and this all can be done in the settings tab. So this is all about the electronic health record system, which is very easy to use and very comprehensive. Now, when the doctor orders a prescription or a medicine from the EHR, the order can directly go into the pharmacy, in-house pharmacy, if a clinic or a doctor has an in-house pharmacy. If they doesn't, then they can ignore the pharmacy area. Otherwise, they can always go here where it shows the order for that pharmacy, and the person sitting on the pharmacy can go and see what order has been placed by the doctor. The pharmacist can also view the entire order at the same time by clicking on View RX tab, and then the pharmacist can select the batch number, expiry date. All these things will come in automatically based on the inventory made by the pharmacist. So a complete pharmacy can also be managed by Gennie using this product, where it can create the entire inventory, it can create the entire purchase list, it can create the supplier list, and it can do billing very well, so that the doctor or the patient can get the bill directly done at the pharmacy without taking the prescription manually to the pharmacy. Now, coming to the billing part, billing is one area where the billing can be done in multiple ways. One way I showed you was to directly go from the appointment scheduling. The other way is to come to the billing section and look up for the patient. So I'm gonna pull the same patient which I did earlier. And now I will have to choose the visit, for which visit I am going to bill the patient. I choose the visit, then I can select any type of billing item, and all the other information I can select here. I can choose the discount in percentage of rupees, I can select the tax if any, and then I can add more items if the patient has used more items, for example dental crowns, and then I can collect a payment. And when I collect the payment, the bill is made, which can be again emailed or messaged to the patient, or it can be printed if the doctor wants to print the prescription and give it to the patient. So this is a very nice bill, and uh, doctors can, or the staff of the clinic can send the information over the email. There is a billing history where the doctor can see the history of all the patients and what bill has been made for them. So the doctor can see when and what type of bill has been made. Billable items is where the doctor can create items which are to be billed in the clinic, and there is a refund section where if there is a refund to be made, then it can also be done here. Now let's come to the laboratory first. If a clinic has an in-house laboratory, then this can be used very well like a regular lab. You see here that when I ordered a lab for patient Senki Goyal, the lab order came in directly in the laboratory section. So the person sitting at the lab can see the order coming in and create a bill for the lab. And the person can see all the labs which has been ordered by the doctor and the cost associated with it if it is already in the system. And then they can provide discounts if they want, they can put the tax information, and then collect the information. You can choose if the payment is done by cash or card or a check. Once the payment is collected, it will again create a very nice bill for that payment, which can again be emailed or SMS to the patient. Similarly, if a patient walks in directly from outside to get the lab work done, that can also be managed using the lab work order. The doctors can see the lab billing history, lab history of all the patients by patient name, order a lab test for any outside patient. They can create components which is to be printed for the lab results. And thrash orders is when a patient is ordered a lab in-house but they want to go outside to get the lab work done. The similar concept is being used for radiology. Radiology also uses the same concept like laboratory, where the order comes in directly and all the same procedures are followed in radiology. Now I'm going to show you some of the jelly beans, the colorful jelly beans you see on the top. The first is the follow-up. Follow-up screen shows which all patients are supposed to do a follow-up with the doctor on the given date. The staff or the doctor can go to this screen and see all the patient list and follow them up to see if they are coming for a follow-up or not. The Gennie system automatically sends SMS reminders to these patients so that they are aware of their follow-ups. The staff can do again a follow-up by calling them or by sending them messages. Once the confirmation is done, the patient can be marked as confirmed for the follow-up and it is confirmed. So this area helps the doctors and the clinics and also the patients in a very effective way, where the patient remembers to do a follow up with the doctor, and the doctor also knows how many patients are supposed to follow up and they can manage their schedule accordingly. The second screen is a sent message, the second jelly bean, which is in green color. I'm going to show you what this is used for when I go to the report section. The third is today's appointment, which shows how many appointments are there for doctor today. The other next screen, which is an orange jelly bean, is the messaging. This works in the same way as how you use your email system. This message system can be used by any of the staff or the doctor to send message to the entire staff or the doctors internally inside the clinic for any kind of sharing the information. I'm going to show you an example of how you can send a message. So a doctor or a staff can share any information using this internal email system, which is very secure. You can see all the sent messages. You can also see all the messages which have come into the inbox. In this case, I don't have any right now. So this is what the messaging jelly bean does. The last one is the notification, which will be used by the Gennie company to send any kind of notifications to the doctors or clinics. Now I'm going to show you the reports section. The reports section gives you all kinds of reports which a doctor or a clinic needs to run their business in a very organized way. The first report you see is the registration report, where you can see how many patients have been registered. So I'm going to choose the date from January 1st, 2018 to 25th November 2018. I can select by gender, but I don't want to do that right now. So I do generate, and then it will give me a list of all the patients which are registered in the system from January 1st, 2018. It gives me a total result of 83 here today, and I can also download it in Excel or PDF and use that report or print it for my own purposes. Then you see on the left there are different kind of OPD reports. A doctor or the admin or any of the staff can see how many appointments have been made or how many OPD visits have been done for the selected date, and it can also be done by a particular doctor. It can also be done by a diagnosis, for example, how many diagnoses of viral fever the doctor has done or how many of the certain procedures the doctor have done, and then I can generate the report. Now this is showing me that there have been 38 appointments with Dr. Sudhanshu Goyal from November 1st, 2018 until November 25th, 2018. You can again download it in Excel or PDF for your own convenience. Then there is a cancel appointment report where you can see the cancelled appointments so that you can forecast how many appointments are being cancelled by your patients. Patient waiting time report, you can see how long the patient has to wait for their turn to see the doctor. Then comes to the billing report. Inside the billing report, you can see the cash collection report. You can choose a date, range of from since when you want to see the collection report. You can select all, and then you can generate the report. In this report, you will see what kind of amount or how much amount has been received so far. You can see it in billing, you can see by pharmacy, laboratory, radiology. So it gives you a very good look of how each department is doing in terms of the business on the practice side. You can see total billed amount, how much refund the practice has issued, how much is the remaining amount, how much have been waived, and total cash received, and all the information you need to run the practice very efficiently. There is a report of bill receipts, how many receipts has been done, bill report, bill spending, you can also see that. Then there is a report on inventory for the pharmacy. Then there are reports for labs on how many labs have been ordered, how many collection has been done, how many orders have been thrashed. Same is with the radiology. And then a referral system where how many referrals have been given in a certain time frame to any particular doctor in the clinic. So in this case, you see that Dr. Sudhanshu Goel has been given two referrals of patients Senki Goel and Govind Sharma by Dr. Aman Singh both the times. So this gives you a very good idea of where you are getting all your referrals from. You can also see who are you sending the referrals to in the similar fashion, and overall it gives you all the kinds of reports a doctor or a clinic needs. Now, one of the very interesting thing here is the campaign message. The campaign message is a place where you can connect with your patients, and it gives you a patient engagement with very easy option where you can actually manage your patients and connect with your patients very easily. I have chosen a date range here and I'm going to run a report now. Now this report is for all the patients which have been registered in my system from January 1st, 2018 to February 25th, November 25th, 2018. Now I see that there are total 83 patients. Now what this campaign message does is it gives me an option to send a message or an email. Again, a SMS or an email to all these 83 patients at the same time. And for example, let's say if there is a flu season coming in, and if I want to notify all my patients to come into my clinic and get the flu vaccine done so that they can mitigate the chances of having a flu. This can very easily be done by using the campaign message system. It can also be used to make your patient aware of any new diseases or any new camps which the doctor or the clinic is going to organize in the future, and any other information you want to share with your patients. You can send greetings to your patients on festivals or holidays. You can ask certain patients of similar diagnosis to come in to get an evaluation done, and there are a lot of other things which you can do. So in this example, I can ask all the patients to please come for the flu vaccine. And then you can send all the SMS from here. Same thing can be done on an email system. So this is a very smart and easy way for the doctors to communicate with their patients and use this system for patient engagement and preventive care. I'll give you one more example. WHO standards says that all the women above 40 years of age should get the cancer screening done. Now, this is a great area where you can run a report based on the female greater than 40 years of age and asked all the women to come and get the cancer screening done. So, this not only provides information to the patient, it also gives preventive care to them, which is a great step from the doctor or the clinic side to take care of the patient's health. Now, the messages you send from the campaign messages are being counted by the system, and this is where this jelly bean, the green color jelly bean on the top you see which says send messages, is counting all the messages you send from the campaign system. So it gives you how many messages you have sent so far. The last is the right hand side section on the top, which gives you the subscription information. You can provide feedback to Gennie team. You can create any support ticket in case you run into any issues. You can always come to the support center and you can send the information, and somebody from the Gennie team call you right away and fix your issue as soon as possible, and then you can log out from the system right here. So this is all about a very smart and good Gennie system where you can use it to manage your entire practice or a clinic digitally and manage the information and the health record of the patients and share that information with the patients very easily. There is a mobile app also connected to this system where you can use it on your mobile phone. It works both on Android and iOS and gives you a lot of functionalities which is very handy. For example, you can manage your complete appointment scheduling, health record, digital prescription, billing, and some other functionalities which you can do from your mobile phone also. I will show you that in my next video, but I hope you like this video and you will try Gennie for your practice. Thank you very much today.